Okay, here is the lecture on healthcare in Japan, the objectives for the lecture, and some demographic information. You can see that they have a population of 127 million individuals. Japan is about the size of the state of Montana. They do have a long life expectancy. This is one of the longest life expectancies that we have seen. And they have a low infant mortality at 1.6 deaths. About a quarter of their population lives over the age of 65, and they have a low obesity rate. You can see that their healthcare spending per capita is $4,766. So it's a lot less than the United States, but it is a lot more than some other countries that we have seen. Some characteristics of the healthcare system in Japan, things that they have considered when creating their healthcare system. Their healthcare system is run by the government. Healthcare is considered a birthright, and everyone is provided health insurance. The interesting thing is that the government determines what benefits are covered, and they also set fees. They set the prices for all services. So physicians and hospitals cannot charge more than the set price. And there is a fee book that is published that lists all the fees for all the different services. They provide universal health care, so everyone has access to health services. Everybody must have health insurance, and all insurance plans must offer the same basic benefits and services that are determined in the benefit package set by the government. Individuals are able to choose their doctors, and everyone has access to the same doctors. They have several groups and organizations that oversee the health system or have a part in creating the health system. So the Central Social Insurance Medical Councils, this is the group that is in charge of determining what health services should be included in the benefit package and how much all services should cost. The fees and prices for health services are reviewed every 2 years. The Japan Council for Quality Healthcare, this is the group that oversees the quality of care and sets standards of care and guidelines for clinical health services to make sure that individuals are receiving quality, effective, and efficient health care. They also have an organization, the Pharmaceutical and Medical Devices Agency, that also looks at the effectiveness of medications and equipment, and they also look at the prices, and the goal is that services are provided based on a need and not for making a profit on those services, as in some countries such as the United States. Many times services, especially prescription medications, are provided at such cost that individuals can't afford them because they are prices are set to make a profit off of the sale of those pharmaceuticals. So what health insurance systems are within the healthcare? So they have statutory health insurance system. This is called the SHIS. And as I said before, this is universal. Everybody has access to the same services. Everybody must be enrolled in the healthcare system. They do have the right to choose where they receive their health services. all of the insurance plans within the SHIS, because there are choices. Not everybody has the same health insurance plan. There are several or many health insurance plans within the statutory health insurance system. And so all plans are required to provide the same basic benefit packages. And there is a penalty for not enrolling in a health insurance plan because it is mandatory. The three common categories of the health insurance system is the EHI, the Employees Health Insurance, the NHI, the National Health Insurance, and then they have health insurance for the elderly. So everyone in the population must have health insurance with one of the three categories of health insurance. They do have private health insurance, but not many choose to have private health insurance because they will fit into one of these three categories, and they provide adequate health insurance coverage. So there's only a few in the population that choose private health insurance. Just an overview of what are the services that are included in the benefit package. Inpatient, outpatient care, mental health, prescription drugs, home care, hospice care, physical therapy, as we see here that we do not see with other countries, is dental care is included, eyeglasses for children is included, cancer screenings, and preventive care. So it covers basic needs that an individual would require or have. Okay, the EHI, the Employees Health Insurance Plan. The EHI is the main insurance plan. So this is for all individuals who are employed with a company or an organization that has 5 or more employees. All companies with 5 or more employees must contribute to the health insurance plan for their employees. Okay, actually, let me go back. This is for all individuals who are employed. Companies that have 5 or more employees must contribute to the health insurance plan for their employees. So, companies that have 5 or more employees are required to assist their employees with their health insurance. So, in the EHI, individuals do pay a monthly premium for insurance. As I mentioned before, the employer helps. So the cost of the monthly premium is shared between the employee and the employer. So the employer pays part of it and the employee pays part of it. Monthly premiums are based on each employee's income. Okay? And so what they'll do is they will look at a 3-month period of income, and that will be used to determine their monthly premiums, and it is adjusted every year based on changes in income. And so the monthly premium, individuals will pay 8.2% of monthly income if they are 40 years old and younger. Okay, so 8.2% of their monthly income is taken from their income for health insurance. If an individual is older, between the ages of 45 and 65, then 9.45% of their monthly income is taken for health insurance. Now, remember, I said the employer helps pay for their health insurance, so the employer will pay half of their monthly premium cost. Okay, and as you can see, almost 2/3 of the population are covered by the EHI, or the Employees Health Insurance. The National Health Insurance Plan. So this is for individuals who are not employed and eligible for insurance through the EHI. So the NHI provides health insurance for those who are unemployed, self-employed, retired, or work for companies with only a few employees. Monthly premiums are based on income. As you can see, it is though based on their individual income. So it can range anywhere between 5 to 10% of their income, and there is a maximum amount that is taken yearly for premiums. The NHI is administered and overseen by the local governments, and so therefore premiums can vary depending on the city that you live in. Both EHI and NHI provide health insurance for dependent family members in the same household of the primary person. Retired people are not eligible for EHI, but can receive insurance under NHI or become a dependent of an adult child who has insurance through EHI. How is the healthcare system financed and paid for? It is financed by contributions from the government, premiums paid by employers and employees, and it is paid for out-of-pocket cost or money paid at the time of health services. Individuals do pay for health services at the time of receiving them, but the cost is fairly low. An average annual out-of-pocket cost per person is about $600 US, which is relatively inexpensive when looking at some other high-income countries, such as the United States. They do not have yearly deductibles, so the health insurance plan helps pay for health services from the beginning of the year. They do not have to meet an annual deductible first. And as you can see, for the EHI, the out-of-pocket cost, each person pays 30% of the service at the time of the service. Also the same for the NHI. And remember that all the costs and the fees are set and regulated by the government. The government believes that no one should go broke paying for health care. The government sets prices for all services, and physicians and hospitals are not allowed to charge more than the set price. They do have long-term care insurance. This is for individuals 40 years or older. They have to pay extra money into the system to provide long-term care insurance if needed. So the individual does have a co-payment. And this is because when someone gets older and has chronic long-term health issues, they may have to access more resources. So this is why if someone wants long-term care insurance, they would have to pay extra. Services that are included, you can see home care, equipment, nursing services that might be needed. They do have family care leave benefits. This is employment insurance that pays a family member up to 3 months to care for an elderly family member. So it's kind of like a family leave so that an individual can take care of an ill older family member, or a family member. It doesn't have to be older. Sorry, I cannot think this morning. It is for a family member to take time off of work and still get paid in order to take care of an elderly family member. Sorry. Just some information, some numbers on the healthcare system. Physicians, there's about 2.5 physicians per 1,000 people. A third of physicians work in primary care. 45%, once again, just like the United States, we see a larger majority of physicians working in specialty care. As I said before, there is no gatekeeping system. Individuals are allowed to choose their doctors. They can go to a specialist doctor without getting a referral from their primary doctor. The fees for physician services are set by the government. Physicians do have very large patient groups. They see a lot of patients each day. The average time for a visit is 7 minutes. Because of the low cost of services, patients will often go see their physician just to have their blood pressure checked, to get refills for their medications, so they don't necessarily wait until something is wrong to go see their physician. And so this is why they have shorter visits and the physicians have large groups. The focus is on primary care in the outpatient setting. So because individuals are going to see their physicians on a regular basis, they tend to have a low rate of hospitalizations. And they do have an after-hours care. There are outpatient departments in the hospital that provide care after hours. They have clinics and they have actual after-hour clinics. You can see the breakdown of hospitals. They have about 9,000 hospitals. They do have mental health facilities, general hospitals. Hospitals get compensated according to the diagnosis procedure combination or the fee schedule. So the fee schedule tells the hospital what they can charge for different services, and the diagnosis procedure combination is similar to a DRG, a diagnosis related system, where the hospital is given a certain amount of money for each diagnosis to treat the patients. And this is to create a conscious financial treatment of the individuals in the hospital. 63% of hospitals are privately owned, although they do have to follow all the rules and the fee schedules. Privately owned, as I said, must follow the fee schedules. They cannot charge more. Technology in Japan is high tech and it is up to date. And you can see, compared to other countries, they have a pretty large number of scanners to diagnose conditions. So CAT scanners, 93 per 1 million, MRIs, 40 per 1 million. And the focus on the use of these is on diagnostic and preventative care. Mental health is incorporated into primary care, and services can be provided in the inpatient, outpatient, or home setting. As you saw before, they do have mental health facilities, and there is a co-payment for mental health services. Complex mental health services are provided in specialized clinics and hospitals, but basic mental health needs are provided and integrated into primary care. Some ways that they are trying to improve healthcare. Japan is always working to provide quality care. So they have several different interventions, I guess, to monitor quality of the care. So the healthcare delivery visions is looking at improving care by creating collaboration between healthcare providers, so that if an individual is seeing more than one healthcare provider, each healthcare provider is aware of the management and the treatment that the other healthcare providers are providing. They do have inspections and accreditation processes so that hospitals are safe, effective, and providing quality care. Physicians must be licensed, and they have to go through revalidation processes every so many years. They have the Japan Council for Quality Healthcare, which investigates the report of any adverse event that happens with a patient in the hospitals. And they do have patient surveys that do ask the patients about their experience in the hospital. The interesting thing is, though, that they're only conducted every 3 years. Unlike here in the United States, every time a person is in the hospital for something, every time they will receive a survey to fill out. Japan does not do it that way. It is just done every 3 years, and it's just a general survey, I guess, of their experience in the hospital over the last 3 years. They do have some safety nets in place so that everyone has access to health care and does not go broke paying for health services. So they do have catastrophic coverage. Some individuals, based on their age and their income, may qualify for catastrophic health insurance coverage. This would limit the out-of-pocket cost for them, and there is a maximum out-of-pocket cost. They do have out-of-pocket ceilings, so reimbursement of payments after this maximum amount. So after this set amount is paid, they then will be reimbursed for cost. If a parent is on a parental leave, then taking care of a family member, as we talked before, they do not have to pay their health insurance monthly premiums during that time. There are reduced premium payments for individuals in the NHI. In certain circumstances, their monthly premiums could be reduced. If someone has an unexpected change or loss of income, they might qualify for that. Also, individuals can have reduced co-payments if they have a certain long-term disease or illness. Japan has a long list of 306 chronic long-term diseases or illnesses that if a person has one of these, they can qualify and have their co-payment amounts reduced. They do not have a structured healthcare electronic health record system. Individuals typically carry a little paper book with them, and notes are kept in that book. They are still looking at containing cost, even though they already are making a conscious effort of protecting individuals from financial devastation. So they are things they do to contain costs that they're still looking at. They continue to do is they create the fee schedule for services. They review and revise the schedule every year, and they do provide financial incentives to facilities, to healthcare providers, to improve clinical decision making and making clinical or healthcare decisions based on what's best for the patient, what is actually needed in their situation, and making the focus about the care and quality care for the patients. They have the cost containment plan for healthcare. This is looking at hospital stays and the promotion of healthy behaviors and using pharmaceuticals in an efficient manner and not just prescribing medications just because, but only using them when actually needed and for what they are needed for. So, how does all of this impact the quality of healthcare in Japan? Japan has very high quality of care. This is demonstrated by their low infant mortality rate, their high life expectancy. Japan has found a way to provide quality health care for low cost, and we can see that in their infant mortality, life expectancy. They have high vaccination rates. I cannot talk today. They have high vaccination rates, which contributes to individuals staying healthy. Deaths from cardiovascular issues is low. Access to care. Individuals can choose their healthcare providers. They can choose facilities. They can typically see a doctor within the day, and no appointments are needed, so they just go to the clinic or the physician's office to see their doctor. Now, because no appointments are necessary, people just show up at the clinics and the doctor's offices, they sometimes will have to wait a long time to see the doctor, but they don't have to call, they don't have to make an appointment, and they don't have to worry about, well, if I call and I don't feel good today, I won't be seen for a couple days. They can just go and see their doctor. They do have emergency care. So individuals do have access to small clinics rather than having to go to big hospitals. That is healthcare in Japan.